So once more, so our guest today is Dr. Rajeev Naidu. He's got a gifted ability to help people connect to their highest potential and achieve their dreams. He's somebody I know for many years, but in the last 5 years, because of our TA kind of journey together, we know each other really well. He's practicing, I don't know whether he practices kind of homeopathy, but he is, I've seen him in his clinic doing less of, giving people pills and more of giving them peace. So Rajiv is definitely somebody who gives people a lot of peace, which is something I've seen, but I know that he's a fantastic counselor. He's also a hypnotherapist, does past life therapy. He also trains people because he's attached to the California Hypnosis Institute since 2006. He trains people to become a qualified clinical hypnotherapist, trainer level 1, 2, and 3. He also does advanced neuro-linguistic, which is something that he's trained in, and he uses it also. Gestalt therapy. He's also a practitioner in TA and an integral somatic therapist. There's lots more which I can send you all to read. But I think today Rajiv is going to enlighten us on a modality, core somatic, which is something that he himself has devised. And I myself have done a 2-day workshop with Rajiv on it. And it was really very interesting. So today I think we're going to get great insights into a new form of therapy. And not only that, Rajiv has also presented a paper on core somatic integration, which was, I think, in Dubai. And a lot of medical practitioners, kind of were there in that conference, and they were quite awed by what he had to say. A testimonial has also been shared on our group, and I think that also gave us a lot of insight into how the therapy works. So Rajiv, on to you, my dear, and love you. And I'm so glad that you accepted this invitation to come and speak on this platform. So go ahead.
Thank you, Trupti. And to just start off, first of all, thanks for the invitation. Thoda formal lag raha, lekin Trupti is someone who's very, very close to my heart. Yeah, when we met, and Trupti and husband also, it's like we just gelled up. There's one more Meena, and we just gelled up, and it is such a close connection, and there's a lot of good feelings for each other. So thanks a lot, Trupti. And I look up to Trupti as someone. I was just talking to my wife today. She's someone who's so grounded with all that understanding and knowledge with hypnotherapy, which is, can go around in air, but she completely grounds it and makes it so scientific and has an understanding and explanation of everything that she does. And I am quite sure most of you are her students, almost all of you. She's got the energy of a child when she talks about therapy and about her clients. And that is unbeatable. That's unbeatable, because she just becomes a child. She's not even aware of what's happening. She's just completely a small child who's so energetic, as if she's found a new toy. And I think that toy becomes new every day. Right? And especially when she has to study, she's like gobbles of the whole book. I just keep wondering how she does it. So great. So
thank you, Rajiv.
Thanks a lot, dear. And thanks each one of you for being here. Yeah, it's a great pleasure. And I just did one session on anxiety, beating anxiety. Yeah. And now I am doing something that is so close to my heart, that is core somatic integration. And let me also acknowledge Trupti. I want to acknowledge you right on the group over here, because Trupti has attended. And for me, Trupti has always been someone who's like senior, and she's done so much of work. Like and when she came in, there was something that she spoke about. She was someone who acknowledged the work. Remember, just before leaving, and she was so open-heartedly acknowledging it. Then she said, Rajiv, this works because when we talk about transactional analysis, it works on the somatic child. You remember the thing?
Yeah.
The C0 of the transactional analysis, and that completely changed my way of looking at core somatic integration. And really, I really want to thank you from the bottom of my heart for that statement that you made. Because after that, it has been, I have been working with people, and now I know why core somatic works. But you were the one who actually put it across to me, and you said, Rajeev, this has to go places. So really, thanks for that. So I really want to acknowledge you on the public platform.
Thank you for the super stroke.
इसके लिए वो तो book को gobble कर लेती है. So let's go. So I'm going to show us, put it on a PowerPoint. Yeah, and I'll be talking about my own stuff also, but I'll be talking about some of the thing about the kind of therapy and the kind of healing that is done. Whatever we can do in this, I think we have 1 hour, 15 minutes or something each other. Yeah, max 9:30, right? Max 9:30.
Yeah, max 9:30.
We'll try to finish it off by 9:15, 9:30 max. Yeah, and you can ask questions. Yeah. So I am a homeopathic doctor, as she said, and I was going through this journey of homeopathy, and then I got into psychology and counseling and health psychology. But something happened on the way, and I started becoming a bit disinterested in what is happening. Just getting disinterested in what is happening. And then slowly I started noticing that I went through a lot of anxiety for almost 10, 12 years. Anxiety, irritable bowel syndrome was always there as like a partner to me. And also going through a lot of depression for this 10, 12 years. And things were just not working because I just lost interest in my work and everything. And something which I was growing in homeopathy big time. And that is where I started, like I would wake up at nights, have severe panic attacks. I would palpitate. I will hyperventilate, and I didn't know what to do. And I would just sit there for 2 hours from 2:30 to 4:30 every day, every night. And I had this. We were staying in one room. My wife, me, and my older kid. Now I have 2 kids. And I couldn't even scream loudly or cry loudly because my wife is there behind, and she would wake up. And those 2 years, it's just 2 or 3 years, it just continued like that. But there was one thing that happened, like when it's at the darkest point of the tunnel, you see the brightness of the light, and that is what happened in my life. The very thing that was suffering from, I would sit down with it and I would just notice what's happening. I would say what's happening, and I would pray to Babaji. I would pray. I said, "Yeah, wo kya raha hai mere saath?" And I am not able to make head nor tail of it. And I'm only crying, and I can feel so much of pain in my chest, a hollow pain. You all know what it is. And after some time, it would just settle. And the same thing would happen in the afternoon. After some time, it would just settle. And I would wonder what's happening. But there was something that really opened up for me at that time was, if I can be with something in my body for some time or a longer time, it has a power to change. It has a power to transform. I still remember the sentence running in my head so clearly. And that was the beginning of my stepping into core somatic integration. And that was the beginning where I didn't call it core somatic. Core somatic integration name was given in 2010, but this was somewhere in 2003, 2004. And I was trying to know what it is because I thought it's all a figment of my imagination. I'm making up stories. I think I'm very creative, but I didn't realize I had stumbled upon a therapy which is so effective and so fast. But it took me 15 years or 17 years to actually understand. In fact, it's only during the lockdown I started understanding the efficacy and the effectiveness and the speed at which this works. But it has taken me good 15 years to even know how it works. Yeah. So, and it has all been step by step working on myself. It's like an experiential thing. So that's why I just go inside to figure out what's happening. And it has really given me a kind of insight in myself, a big amount of awareness. And like I had one client, I think she must be here today, called Kanti. And she said, Rajiv is someone who has experienced what he's going through, and that it is his experience that through which he's healing clients. And I was really touched by that there was someone who's just met me a month back, and she could understand that. So that was like a very big dose of appreciation for me. Yeah. So this really worked, and then I started seeing a huge change in my relationships with my wife. Like, it's one of the most brilliant relationships that I have, and I could actually relate to people also. Like a huge shift in thinking that has happened, and that is all because I didn't have to go anywhere else. It doesn't matter what I do in my life. I have one place to go, and that place comes with me all the time, and that is my body. And I use it like 24/7. It's my best friend, and I'm with it all the time, as much possible. And the kind of spiritual development and growth that it has given me, that's like I I I can just look up, and I can just be in gratitude. So that's the kind of shift that has happened, coming from a point where everything was bad to bad, relationships not working, health not working, finance not working, not able to think clearly, very confused, very negative, very depressed, to a point where people say that how do you manage so much of energy? And I can say my energy is at least 5 to 10 times more than what it was 5 years back. It is that kind of energy. I can give a 25-year-old a run for their money, even when I'm playing basketball. So that is the kind of energy that has grown. And like, I still remember when we were doing transactional analysis, and I said one sentence when my car was towed away, and stood screaming at me, talk, don't talk negative, stop talking negative. And I think if that is what she caught on, and I really took it seriously, I said, she got it. And but then 10 years back, 15 years back, every word was negative in my head. And today, every word is positive in my head. And I can say that it's a journey, it's a beautiful journey. And when you get in there, or rather get in here, that is when people, I think, start saying that life is so beautiful. It doesn't matter where you are and how you are. It's so beautiful. And like, if you had to live your life again, I think most of the people at this juncture would say I would live it again the same way that I've lived. Because it's so beautiful. Yeah. So so that is one sentence that really helped me change my life. That is why it's always in a high self-esteem that I hold as a friend also, and otherwise. Great. So let's talk about. I will take the questions towards the end. If there's something that is burning and you think it's very urgent, just put up your hand there, and I will see to it that I'll answer the question in the end. Right? So that is how I'll do it. Okay, great. So let's move. Ah. So if you can see me, just give me a thumbs up. Yeah, thumbs up. Okay, great. So this is my institute called New Life Institute, Integrative Wellness Institute, because this is what I have got, a new life. And I call myself a new life educator because I it's not about just healing, but actually people thinking differently. People actually thinking in a very positive manner, not and it's not just about them healing. When they heal, their family has to heal. Their people have to heal around them, and everyone has to live a very happy, healthy life. And that's my intention all the time. Yeah, and that is what I live life for, and that is what I train people to. Yeah. Thank you very much for attending. This is me in various avatars. Yeah, this is how I looked just few months back. Okay, these are some of the workshops that I do: somatic integration, transaction analysis, clinical hypnotherapy. Now I'm coming up with new, creating happy relationships, creative visualization, a lot of things. I'm also a Tai Chi and Qigong master, which has really, not master, sorry, Tai Chi and Qigong practitioner. I've been training people for some time. And this is something that really helped me in somatic integration. So I'll tell you where it started. So my teacher, Dr. Menon, yeah, who's 70 now, maybe 65, 70, and an MD physician. So he was like someone who just mentioned saying that when I was doing the second or third class, he just said it is. He said it's
Doctor, please excuse me. You're very soft and not audible.
is
Could
it
you?
is it
Yes,
am I
yes,
soft
please.
and audible and you cannot hear me? If you cannot hear me, tell me
Doctor, I'm
this.
so sorry. I could not hear anything, but
Yeah, Carol,
could you?
just a minute.
Yes,
Carol, just a minute.
sorry.
Let me figure out. Am I audible? Was I audible till
We can
now?
hear you.
Yeah, yeah, you are audible. You are
So
Yes.
audible
Carol, you
even.
will have to change something from your side. Yeah?
Yeah.
Yeah, because I am yeah, Carol,
Maybe
just
she
check.
should
Just
just
leave it speaker.
increase her volume in the
Yeah,
computer.
you have to increase your
Yeah,
volume,
maybe the
Carol. Okay, great. So, and then my teacher said, it is easier to go. Listen to this. This is very important. I think my whole journey is because of the statement and thanks to my teacher all the time. It's easier to go from the gross to the fine, but it's not easy to go from the fine to the gross. He said it's easier to go from the body to the mind, but not easy to go from the mind to the body. And this is more reliable, the body. And I don't know what happened that day. It just stuck. And that's where the journey began. I said, what did he mean by that? And then I went through anxiety, all the struggles, but I I understood. Maybe he just came in, and I was the only student he taught for 10 years or 5 years at least. There was no one. He would never do it for money, nothing. I went, I told him, he started teaching me. And wonderful teacher. Like he stepped in as a guru in my life. So it was like that's where my journey began. So this is so important. And core somatic is based on that. Going from the body to understand what's happening inside you. And you stay with the body because the body always speaks the truth. The body never lies. The body always speaks the truth. And I'm very sure Trupti would also say yes to this. If it is not healed from the body, you are not healed. If you are just healed at the head, the mind, that is what most of us do, you will still remain sick because the mind can play a trick. But the body will always be a good friend and always tell you the truth. So trust the body. The body is talking to you even right now. Like right now you're sitting and you're feeling discomfortable, uncomfortable. It is talking to you. You're feeling your breathing is not okay. It's talking to you. You feel, oh, my stomach is full. It's talking to you. You feel satisfied. It is talking to you. You feel, oh, my throat is dry. It's talking to you. You feel a chest pain, back pain. It's talking to you. You feel that, oh, I'm happy and I'm so excited. My whole body is like as if it's floating. It's talking to you. It is talking to you all the moment. Only thing we don't listen to it. And we don't listen to it in a way such that it heals itself. The body has the capacity to heal itself. We don't listen to it in a manner or communicate to it in a manner such that it heals itself. We got to listen to it in a manner that it starts healing itself. Remember, in childhood we got cut, or even now, you bhajia talne ka, and that oil drop falls on you, hot oil, and you don't do anything. Yeah, you just allow it, and the lady or the man is going through his daily chores. But after 7 days, it's gone. You have a scar. Then you say, "Oh, I had that oil spill on me, hot oil spill." But that's it. How did it heal itself? It has the capacity to heal. We have lost the ability to connect to the innate ability of the body's healing mechanism. And then we are requiring so much of medication. And then we seek help. We feel helpless, not realizing that you just need to recap. You just got to go back. Are we together on this? You just got to go back and reconnect to the body. And once you're able to reconnect to the body, it does its own job. And the job is like it knows exactly, even if you say, oh, I am not going to tell her what I am thinking. The body says, I know it, and I'm going to give you a disease for that. Because you're holding a secret which is negative. So you say, but she doesn't know it, but you know it. The body is so super intelligent. The body is super intelligent. That's why the only thing that works with the body is authenticity. The only thing that works with body, with your health is authenticity. What works in a relationship? Authenticity. What works in a relationship? Authenticity, integrity. What works in health? Integrity. When you're disintegrated, you have a disease. And how does disease happen? Disease happens. What is disease? We all know it. I am quite sure that most of you are therapists, counselors, and I definitely have learned from Trupti. Disease is nothing else but a state of unease or away from ease, right? We know that. That's unease, away from ease. Now it doesn't matter. You don't have to have a disease, a full-blown cancer to call it disease. Even if you're sitting wherever you're sitting and you're feeling not comfortable, it's a disease. Are you with me? And then we go for easiness. We try to figure it out, and that's how we heal ourselves. It's as simple as that. Now, what creates a disease? Let's try to understand that. Okay, I will go with the method of understanding understanding animals and human beings. Now, what happens with an animal? Yeah, we are all similar. With mammals, we are similar. So most of you have seen dogs attacking other dogs. Yeah, one dog is in between, and all the other five are attacking. Uska tang katte hai, pooch katte hai, and then it gets up. Then it runs in a corner, and then what it does? It shakes itself. Yes or no? It starts shaking itself, and then it's back again, walking. Yeah, eating. So what happened? It got traumatized. But if you notice, the animal doesn't hold on to it. Yes or no? But what happens with us? You know what? I was in college, and that guy, he was dating me, and he was also dating the other girl. कितने साल पहले? 30 साल पहले. Comes in my mind even now. I can't be with my husband. अरे 30 साल पहले हो गया. अभी क्या कर रहा है? You know what my mother did when I was small, 5 years old? I went to her. She was cooking and she said, "Go from here." She hurt me. She's not my mom. कभी हुआ? 40 साल पहले. That's why I don't talk to my mom. 40 साल. And this goes on and on. अभी बहुत सारा है. Husband did this. My wife did this. मेरे बच्चे लोग मेरे को कैसे ट्रीट करते हैं. ज्यादा उनके साथ नहीं होता है. But माँ बाप और husband. Right? Friends. When I was in school, I gave my book to my friend. But when I needed it, she didn't give me. Or he didn't give me. All the people they take advantage of me. They use me like a doormat. And then the story continues. So what happened over here? There was a trauma. You experienced trauma. Trauma is nothing else but when you feel shocked, when you feel helpless and hopeless and you cannot do anything about it. My mother said, go. Now that was not the problem. The child said, what about my survival? I will die because where do I get food from? Because my mother said, go. Now that small child or that newborn child, just 2 months old, 5 months old, 1 year old, वो लेटा है बेचारा उसको तो सुसु करेगा तो साफ भी करने को नहीं होता है. And now he's like crying, he or she is crying, wah, 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 wah. And the mother is not coming. What happened? Now the child goes to God. If my mother doesn't come here and give me food, I am going to die. Are we together? And that can be traumatic. Now we don't realize that trauma. Are you getting me? And then, but what we do with the trauma? शाम हो गया 7 बजे ऑफिस से निकले सीधा गए बार सुदर्शन बार श्री कृष्णा बार लोटस बार 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 लगातार शाम को 7 बजे से 10 बजे तक and what do you talk about? Amit is happy now. He's saying मेरे बारे मेरा language बात कर रहे हो तो just joking. So it's like okay and then what do you talk about? तुमको पता है मेरे पिताजी ने क्या किया था? उसने मेरे प्रॉपर्टी मेरे भाई को दे दिया था. किधर है पिताजी? पिताजी मर गया. कभी 25 साल पहले. तो तू क्या कर रहा है? ढिंडोरा पीट रहा है उसका. But this is how it is. We use that trauma and we, instead of healing it, we keep talking about it. We keep nurturing it. नहीं, it's a secret. मैं किसी को नहीं बता सकता. क्यों नहीं बता सकता? और अंदर उसको. And then it becomes a full-fledged disease or it becomes a pain. And then you get sciatica, you get migraines, you get cancers, you get paralysis. I have a case of paralysis like healed in 20 minutes. A case of a heart problem, I don't even remember what was that, or kidney, and she was supposed to be operated, and now she just called me up after 5 years or something. She's saying the doctors are still wondering कि was करने का कि नहीं करने का, because the symptoms are not appearing, and she was supposed to be getting operated 4-5 years back. She called me up for her daughter, and she's saying मैंने बोला operation हुआ, तो then doctors लोग अभी वो symptom कहाँ गया? वो हार्ट का जो सिम्टम था वो किधर गया? We are waiting for that to come up so that we can operate. Nothing, just 2 sessions. Mahim, I just went to her place and simply did it. Physiotherapist. So this is how it works because we are going into that area where it matters, and that's in the body, in the bodily experiences, not the body even, the bodily experiences. Your disease and your life and your health is stored in your bodily experiences. And if you want to heal them, you got to heal them at your body level. Body experience level. Even if you're doing a past life, I have seen people, they go there and they do all the lafada over there, but they're still at the mind level. Kya hua tha? Kya hua tha? Kya hua? But they don't go there. And the people who are able to get in there, what happened over there? And zoom, 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 they can see a shift happening in the body, and then the person is okay. Like I still remember, Tutti, you had told me about that story about that lady who fish or something. Remember?
Yeah. Fish.
Yeah.
Deepti Palkar. I think most of my students know about the fish.
Yeah, and this is like the kind of work. And she says, boss, इसमें ज़्यादा और क्या काम करने का? इसमें ज़्यादा क्या काम करने का? इतना काम करने का होता है. She finds herself, and it is not, it's a very symbolic thing, metaphor, because the body, and this, listen to me now, friends. The body, we keep talking about the mind. But most of them have not understood the mind because they are looking at mind as a concept which is drawn on the paper. And they are trying to figure out conscious mind, subconscious. Where is the subconscious mind, by the way? Anyone?
It is in each cell of our
body, in the body, in the gut.
Each cell of
Yep.
Yeah.
By the way, the body itself is a subconscious mind. It is not anywhere. This could be a surprise for people. The body is a subconscious. आपको इधर हाथ लगाने से आपको कुछ होता नहीं है और तुम्हें पता ही नहीं कि क्यों होता है वो. बोलते I don't know, that person touched me over there और कुछ होने लग गया मेरे को. It's a subconscious. Or someone comes close to you and you go like this, or someone touches some area and you go reactive. ऐसा क्या कर दिया है उसने जो तुम्हारे हाथ के ऊपर हाथ रख दिया, तुम्हारे बटक के ऊपर टच हो गया तो तुम्हें इतना रिएक्शन क्यों हुआ? Because subconscious, it doesn't think. Are we together on this? Yes or no? Does that make sense?
Yes.
It's simple to understand. But we are looking at mind. इसके अंदर क्या चल रहा है? And everyone is searching over here. But it's very simple. The body is the subconscious. Where are you searching? The body is talking to you all the time. Right now also it's talking. I'm hungry, I'm thirsty, I'm feeling irritated, I'm getting pain, I'm not comfortable, I'm happy. बात करता जा रहा है, सुनते हो क्या नहीं? Are we together on this? So you got to start listening to the body speaking all the time. The traumatic experiences. So the trauma, in case of an animal, what happens, this is proved. They have done research on polar bears. So when I'm doing core somatic integration, I show the video on polar bears. Kya ho raha hai? And it is being tagged, it's been shot. But what happens is that it's not able to fight or flight. It's not able to run away. So it goes into a freeze mechanism. So जैसे ही वो उठता है पहले वो complete करता है. Are you getting me? Then it becomes okay. हमारा क्या है? We have traumatic memory. What we are doing? No, we have to show that I am strong. We are not supposed to show. We are not supposed to show weakness. मैंने किसी को कभी नहीं कुछ बोला ना, खाली ये मेरा दारू है ना, बस उससे चला है मैंने कहा, किसी को नहीं बोलता हूँ मैं. But you're suffering because the trauma needs to be processed, and it can only get processed when you are talking to it, you understand the communication, and that's what somatic does. It helps you process the information that got knotted up. The frozen experience, because there are 3 ways of reacting, that is fight, flight, and freeze. Fight, flight, and freeze. When you are, listen to this, friends, when you are in fight and flight, chances are you may not fall sick because you're using up your pent up experiences that's come up. Are you getting me? If you are able to, that's what animal does. He goes and does this. तो उसको problem नहीं आता है. But हमारे पास ऐसा chance किधर है? We want to hit that person. Most of them want to hit the husbands, right? कितने लोग हैं? Or your own children, but you can't do it. Now you can't do it at all. So all that experiences are stored up. Or you want to run away. I don't want to stay in that marriage, or I don't want to stay with that room. I don't want to talk to my, but I don't want to relate, but you cannot do it. I don't want to be in that office. Fight and flight is being aborted. And then otherwise it's so helpless that I become frozen, like rape victims, kidnapping victims. You are threatened. Or police authority. क्या कर सकते हो? Then you get frozen, and that frozen energy till the time it's not expressed, it expresses itself in the form of a symptom. And that becomes a disease. That expresses in the form of anxiety, depression, bipolar disorders, MPDs, multiple personality disorders, and most of them are treatable, are curable. If the person is understanding, is complying, and the person is willing to heal and go through it. That is why most of the therapies that we do, we are able to actually crack the code for the client. Not because we are good therapists, because the person is willing. So all the appreciation to the clients, to the patients, because in their willingness, the healing is happening, because they are willing to reconnect with their bodies. Are we together on this? Making sense? So this is what core somatic, this is the beginning of how core somatic functions. And then we learn to reconnect to the bodies. How does the body express itself? What is the way it communicates?
Feeling and sensations?
Yes, Manju. It communicates to feelings and sensations. It communicates in many ways, but we connect to the subconscious reactions that's in the form of sensations. And there are many ways of doing it. So I had this person who had this some swelling in his pituitary gland. He was in the Navy, but he couldn't tell over there because he used to have severe problems in his head with the difficulty in thinking and all that. And also pains and all. And I still remember he came and I just put him in the chair, and it's an open eye therapy also, by the way. Though people get into subconscious, but it's open eye therapy. And he was there, and within 5 minutes, he started connecting to that pain and he noticed that struggle that he was going through with his parents and all that. I think his father. And there was so much of anger. And I think his wife was sitting over there and he was crying loudly and he was completely lost. He didn't know that he was doing it. He was crying, screaming, yelling. It went on for almost 45 minutes to 1 hour. He didn't say anything, huh? Let me tell you. Zero. Kuch nahi bola uska. But he just kept crying, screaming. And after 1 hour, he got out and he's saying, this is like I'm standing on the Himalaya and I have the most beautiful spiritual experience. Like, ये कैसा फीलिंग है मेरे को पता नहीं चल रहा, ऐसा लग रहा है कि मैं हिमालय में जाके मेरे को सबसे बढ़िया स्पिरिचुअल एक्सपीरियंस मिल गया. Because that grief, that hurt, that pain, he connected to that and he started, and he's saying after that the whole problem reduced. His wife said after that he was not angry. He started becoming much more happier, much more peaceful, much more sorted. I had this lady who came with PCOD, which is so rampant, and most of the doctors say, oh, it's incurable. It is one of the most easily curable diseases. This girl comes to me, she is 21, 22 years of age, psychologist. And she comes to me saying that I am not interested in marriage. I have this PCOD, I'm not interested in marriage. I'm not interested in making boyfriends. I am just not interested in a relationship, so I will not get married. This is the first session. Huh? And then we start connecting, and if she connects to the PCOD, she connects to the anger that she has towards the mother. And in that, and it's open eye therapy. We do all that what is required in the Somatic. And then she does and then she says, Rajeev, this lot of anger is gone now. And this is the first session, 1.5 hours. She goes home, she comes in next week. She's saying, I don't know what, but I have started talking to my mother very well, which I was never doing. I was always very angry with her. Secondly, she's saying, I don't know, but I think I'm getting interested in guys. It's very simple to understand. Are you getting me? You have a problem in uterus. Are you getting me? And the third session, she comes in, she's saying, Rajeev, I think I'm open to a relationship. I knew what it meant. And then she said, there's someone who's coming to see me. I think I'll say yes. She got married to that guy. She is a mother of twins. The children are almost 6 or 7 years old in US. There was this other girl I was working with recently in India on Zoom. And she said, I have PCOD, my periods ka to kuch pata hi nahi, and it's so severely painful. And when we went in there, just checked, and she said, Rajeev, I don't know, but I just feel my physical body, my chest or my breasts are, it's like, they are like jutting out. I said, what does that mean? I said, feel it. And she's saying, I never wanted to be a girl. I always want to be a boy. Obviously, then you'll have menstrual problems, and most of the women go through menstrual, girls, not women. Most of the girls nowadays, they have problems right at the age of, because no one wants to be a girl. They all want to be boys. Now, if all are boys, then whom we marry here? I'm wondering. All gays and lesbians. Gays, not even lesbians, all gays. ऐसा होगा फिर story. But then we worked, and then she came up with, and she's saying, I'm so angry with my father. I said, what's happening over there? She's saying, he's such a weakling. I don't want to be like my father. I want to be like a man. 45 minutes, and she said, Rajeev, this is the most beautiful thing. That's why I call it one of the most effective and most fastest therapy that I've seen. She's saying, Rajeev, I said, my whole chest is going inside. And by the end of it, she says, Rajeev, I'm okay with my breast. And I'm okay with being a woman. I'm accepting my body. And this is just 45 minutes session. I was, even after 15 years of my work, like at least 12 years of my work, I'm really amazed. I'm amazed at how Somatic works. I just keep getting surprised. Like there are times when they go through it and I have tears in my eyes. I wonder ki kya hai, kya cheez yaar. I just feel ki what's this? Like God has given us such a beautiful pharmacy and mechanism to heal oneself. Like how can God be so super intelligent? I keep wondering that He's taken care of everything. Like the mother, na? मतलब पिकनिक जाएगा वो मालूम पड़ा अरे ये नहीं मालूम पड़ा वो मेरी ओपन अप है उसके अंदर ब्रश रखा हुआ है वो ऐसी नहीं ये लड़का तो लेके नहीं जाएगा but you find it there. So it is so someone just said that it sounds miraculous. So I keep telling people that there's no miracle. This is what I've started understanding. There is no miracle because it's already created in a fashion that it has to work. Only thing we have not looked at it in that way. That's why we call it miracle. But इसमें miracle कुछ है ही नहीं वो अपने आप हील होता है बचपन में मार लगा तो हील हुआ अभी भी होएगा लेकिन हम लोग उसको टच नहीं करते हैं तो वो मिरेकल हो जाता है जब साईं बाबा हाथ लगा तो ठीक होता हम लोग बोलते मिरेकल साईं बाबा से जीसस से तुम भी करो ना यार तुम भी उतना अच्छा अपने आप को स्पिरिचुअली अपलिफ्ट करो तुम भी टच कर सकते हो और हील कर सकते हो तो इसमें मिरेकल कहाँ रह गया यस मिरेकल यहाँ है कि क्योंकि it's not something that we are connecting to every time or doing it every day. That's why it's called miracle. But it works like that. What about people who has seizure? Can it be cured? I don't know, Dorothy. I don't know because I will not even say that for any disease till the time I meet the person. Because every person is different. So it's not about the disease, it's about the person. Disease is it's an outcome or it's an end result of something. We are working with the root causes. When we work with the root causes, the disease doesn't have any space to stay in the body. When you heal it completely, the body has to get cleansed and healed. The disease will not stay. Like in homeopathy, it says when there are no symptoms, how can the disease be there? But what happens with the allopathic science? They keep searching for the disease. उन लोगों को डिजीज ढूंढना है होम्योपैथी डिजीज नहीं ढूंढना बोलते इंसान में क्या प्रॉब्लम है तुम्हारे अंदर क्या प्रॉब्लम है वो मेरे विचार ऐसे हैं अच्छा ठीक है उसको ठीक करेंगे वो मेरे को फीलिंग्स ऐसे तो उसको ठीक करेंगे बोले वो सब ठीक करेगा तो तुम्हारा बीमारी कहाँ रहेगा That's why homeopathy is one of the most efficacious science, therapeutic science in the world, the universe. Provided you go to the right homeopath. This is what I say, homeopathy doesn't fail. Homeopaths fail. Same way, this therapist can never fail. Therapists have to grow further. Because therapies में अपना ताकत है. But we, as therapists or as trainers and facilitators, many of us are not able to convey this properly. And most of the therapists or students, they are not able to grasp it properly. It becomes a responsibility that we start understanding this from the base. And that's why there's a lot of study required. And that's why I said about Tutti. The way she gobbles up everything, because she's like, she's not a teacher, she's a student all the time, who works a lot to give the best to people. And that's where the responsibility lies. This is what I've seen. And that's where, because learning therapies doesn't make you a therapist. Learning therapies doesn't make you a therapist. Although you can get certificates just like that. This lockdown, I have not given any certificate to anyone. They keep asking. I said, क्या करोगे therapist certificate का? कुछ फायदा नहीं होगा. But most of them are practicing. Most of them are practicing, and the kind of results that they get is like awesome. I think relationships have changed. Health has changed. We are able to respond rather than react. So this is something that happens in Somatic, because you are more with yourself. And it's like, you just shift. Like I was doing this work with one doctor. She came in 2 sessions back. Today was the 3rd session. And she says, I get so violent with my children. I just don't know why. इतना गुस्सा आता है, इतना मारती हूँ उन लोगों को पकड़ के. And we started working, and she could see that what had happened some time back. I just asked her to connect to the body, and somehow she was very well connected to the body. And she immediately started saying something happened somewhere in college or whatever happened, and that anger is still so strong in her. And the moment we worked upon it, she could feel all the energy draining. It's running through this part of the body, because you can actually feel that energy that is trapped. That is called the unknotting of the energies. You start feeling the draining happening, the discharge. That is called the discharge. And once the discharge is happened, then what remains is the deeper experience of what you actually are. That is called the essence. And if you can connect to the essence, you are healed. And that is what a Jesus does. That is what a Sai Baba does. He just touches you, and there's so much of energy that is there that energy is connecting to your essence, and then rest of that is gone. And he just builds up that energy in you, और उसके बाद healing ही healing है, क्योंकि उनके अंदर कोई block नहीं है. And they are human beings who have raised themselves to the level of God, or a Buddha for that matter. Like, how can a charging elephant come and just stand there without her harming it? Because there's nothing there. There's no Buddha there. There's no human being there. Are we willing to raise ourselves to that point? Build ourselves to that level that we can start healing ourselves at least. But for that, we have to reconnect with the body, and that is what Course Somatic teaches. How to reconnect with the body. How to reconnect with the body. How to stand in awareness. So this lady, today she came in, she's saying, my son, he did something and he lied to me in front of everyone. And she's saying, Rajeev, I was so angry and I started telling him things. But there's a part of me which was saying, you don't need to do that. You don't need to get angry. You got to stop. Why are you screaming at him? She's saying, ये part मेरा कभी बात नहीं किया. पहले तो मारना ही पीटना ही था. But there is some consciousness coming in. I said, don't worry, now it will start healing. Because the consciousness is coming in. Are you getting me? Are you with me? Have we done anything? Have I told her what to do? No. Not told her anything. The consciousness comes because she's connecting to the body. The body knows exactly. And we release that violent energy, the energy of that hurt, that trauma, where there was violence. It's going away. Now she sees this is coming up. The consciousness, the conscious awareness is coming up. And that is where you will start healing. Healing is nothing else but making the subconscious conscious. Healing is nothing else but making the subconscious conscious. So all we got to do is open up the subconscious again and again, subconscious again and again, and keep watching it, and keep watching it. When there are people who are saying, but when I was in a problem, I tried to watch it. You don't read it for your exams, during your exams. You read, you study much before your exams. So you got to do it daily. 10 minutes, 5 minutes, half an hour. And you'll be amazed that how your body starts healing.
Rigo,
Are we together? So this is, I'll just show you some PPTs if it all कुछ अभी कुछ मतलब है तो दिखा देता हूँ. Okay. I'll take the questions immediately after this. Are you here, everyone? So introduction to learn. This was an intro technique to heal any disease. So this is what I say that you can heal any disease. Initiate cellular healing in minutes. DNA healing to reverse program the natural immunity and health. Prevent incurable diseases. We did all this. We are all born as essence. Look at this. We are born as essence. That means pure energy. Then there is trauma happening and the feelings get frozen and then you get a disease. Right? And whenever there's unhealed trauma, the nervous system is under stress. And when the nervous system is under stress, it is almost like driving the car with the clutch on. Matlab, the gaadi will not move, but the accelerator is full speed. It will make a lot of noise, but the vehicle will not move. But the vehicle will go through wear and tear. Same thing, when our nervous system is hyper, you are not moving anywhere, you're not reaching anywhere. But your organs are going through the wear and tear more than normal. Trauma is a somatic experience. It's a physiological experience. So it has to be healed at the level of physiology. You cannot heal it mentally. That's I have seen. I have had people who came in from the trauma experts. This girl who she was screaming rape for whatever reasons, and she was sent to me. And she was there with that trauma person, therapist for almost, not a therapist, but a psychologist for 1 year. And then she came in and we just took almost 3 or 4 sessions, 5 sessions for the whole healing to happen. For the whole healing to happen. And not only that, someone who was not studying, she was in her 20. Someone who was not studying, she said, I'm not interested in study, I'm going to fail. She topped the class. She picked up something that she really enjoys to do after that. She started practicing. She picked up some therapy and she started practicing the therapy. Just a few days back, she wrote on the Facebook, I'm in a relationship. So this is how, when you are working at the trauma, you have to work it at the somatic level, not just in the mind level. You cannot just tell, okay, what happened, but don't think like this. Okay, write it down. It doesn't work because the amygdala will just take over. The brain will take over. You cannot do much. Are we together? Now we have done all this. That's why we'll go fast. No problem. See, we spoke about this. The body is seldom lacking ability to heal. What is lacking is a person's ability to interact with the body in a way to heal. Okay, these are how to heal any disease. Okay. Core somatic integration therapy is a body-centered therapy, and you are tapping into the innate healing potential by releasing the stress or traumatic experience. To health, harmony, and disease, you do core somatic integration, you unfreeze the feelings and the trauma, you release the stress in the nervous system, and you are go back to the essence. That is what we do. I can show you this. The body heals itself. What we need to learn is how to communicate to the body to heal itself. Some of the diseases and conditions in which core somatic integration has shown phenomenal cures are these migraines and headaches, backache, ankylosing spondylitis. I have someone who's got ankylosing spondylitis abroad, and this is something that I want to share. This is very beautiful. This lady, she's sitting in front of me in the afternoon, 3 o'clock, and she's saying, Rajeev, it's so painful. It's very painful. Since morning, I have been holding the walls to walk. मेरे से चला नहीं जा रहा है. तो मेरा back इतना hurt कर रहा है. मैं कुछ नहीं कर पा रही हूँ. Somehow this appointment was fixed. That's why I'm here. We do the session. I have the video. 1 hour later, she says, Rajeev, there is no pain. I can walk, I can jump, I can do anything. And after that, we came again after 1 week and she's saying, Rajeev, koi pain nahi hai. We had started the session 2 or 3 sessions back. So almost the 4th session, she's saying, Rajeev, I don't have any pain anywhere in my body at all. I don't have any pain in my body at all. मुझे मालूम ही नहीं कि पेन है करके. दवाइयां नहीं है, कुछ भी नहीं है. Are you getting me? Another lady who came and she was found out that her husband has got an affair, and you can just imagine what must be going through. And within that one session, and these are difficult cases. Let me tell you, it's not easy to work with people whose husbands are the spouse is having an affair और जिसका बच्चा मर जाता है. ये सब easy cases नहीं होता. Because वहां आप ये नहीं बोल सकते नहीं भगवान ने जो सोचा है वो होगा. बहुत डिफिकल्ट है और बोल के देखना भी नहीं. मैं बोलता हूँ कोशिश नहीं करना. वो हम बोलते हैं ये सही नहीं होता. It is not right. You cannot say that destiny है, karma है. I don't believe that you can put that like that. You can't say someone's husband is having an affair or someone's child dies. You say नहीं भगवान जो करता है वो अच्छा ही करता है. नहीं सही नहीं होता. There is a particular way to go and you can't do it with everyone also. But there is one thing that I have learned over here is how do you build a rapport with the clients? The rapport is the most important thing. And the rapport ke liye you got to know yourself very well. And that is what Somatic does. You know every cell of your body, what it is doing, what it is thinking. Even if I'm saying this, I know why I'm saying it. And then I'm in integrity. Even if you're selling your stuff and you're saying, okay, I want this client to come to next session, there's nothing wrong in doing like that. But you got to be very authentic with yourself. And then you'll see magic happen. And that lady, by the end of one session, she's saying, Rajeev, I am feeling so good. She sent her daughter also. The daughter is going through so much of pain. What's happening between them? And in one session, the doctor says, boss, I am in charge. I know what to do. I am taking charge of my life. They can do whatever they want, but I am taking charge of my life. That is important. And we are not trying to say anything about that because the body speaks. And you have to allow the body to speak. And you have to help people learn to listen to the body. And that's where the power lies. That's where the magic lies. Then therapies become miraculous. Then therapies become miraculous. Yeah, you have to give time because what I understood that time किसी के साथ चाहिए, that's only to develop that rapport, to understand what is the route where we are working. It is not that therapy takes time, but that person का resistance होता है. We have to crack that resistance. Are you getting me? So even if you are working as a therapist, you have got to know that you have to crack the resistance. You are not a bad therapist. The client's resistance, but even the client's resistance is your resistance. So when I'm working with my clients, like yesterday I'm working with something that is supposed to be incurable. No one is getting cured, like HS, where the body mein ulcers hote rehte hain. I worked and yesterday said, oh, I had this food and again it started. So I saw that sense of responsibility that I should heal is not there in her. So I spoke to her about only responsibility. I said, this is what it is today. You're not going to do anything because I would not like to go ahead with you. If at all, I can only hear a sense of irresponsibility. And at the same time, I told, from today, I am going to make sure that I develop a sense of responsibility and understanding such that you get healed after this. Because there's something in me that is not healed, maybe because you are not getting healed. And I'm going to work on this, and I'm very sure that she's going to get it. And I keep observing my body then. So this is like, it's a very responsible place to be in. And that cannot happen by just learning therapies or reading books and becoming a psychologist. Very honestly, I'm not taking away anything from anyone. I'm not taking anything from anyone, taking away anything from anyone. I'm saying, once you start, because I'm quite sure most of you have done some therapy or learned. Yeah, because if you're with Tutti, definitely you must have learned therapies that she's doing. But this is something, that's why I'm adding this flavor to the talk. Yeah, that's the only reason. मैं थोड़ा carried away भी हो जाता हूँ जल्दी, ऐसा है मेरा. GERD, irritable bowel disease. I was a person who suffered from irritable bowel syndrome. Leukemia. This is one person who got cured brilliantly within 6 sessions. Someone who couldn't even walk 10 steps. He played an instrument in Pune concert for 4 hours. That is leukemia. PCODs, PCOS, menstrual problems. That doctor today, she's saying my menstrual pain so hua hi nahi. Uska problem hi nahi hua. We just done 2 sessions with her. Behavioral problems, overcoming addiction. I have a lot of people who are addicted to weed. One of them was addicted to brown sugar also long time back. A lot of people are addicted to weed, cigarettes, and alcohol. They come. If they are responsible, I can guarantee change. Pain disorders, obesity, relationship conflicts, big time. PTSDs, stress-related problems, depression, anxiety, OCDs. I have big time OCD cases, fears and phobias. Trauma from death and loss, and many more. Core somatic integration. So I'll just talk about this. Tutti, can I talk about the workshop?
Yeah, of course, Rajeev. Please do that.
So, and then I'll take up questions, because if at all we need to, then I'll take all the questions. Okay. So, core somatic integration, I'm teaching it in 2 days, which is happening on this Saturday and Sunday. Yeah. How to have freedom from disease without any harmful side effects of medicines. Learn in 30 minutes step to transform disease into natural health. In 3 hours, there's one simple methodology to have freedom from diseases without medicines, with no side effects. How can you accelerate cures? I've written 50%, just being modest, but it can really go very fast. Like I have one case right here, I can show also. Cures of psychological issues, effective results in shortest time possible, very useful for therapists, doctors, anyone. Housewives have taken it up, actors have taken it up, a lot of other people have taken it up, lawyers have taken it up, CAs have taken it up. Develop self-mastery, because it's all about awareness. Okay, I'll tell you the fees also. So it's on 27th and 20th. That is this Saturday and Sunday, not Friday, Saturday, Sunday. It is from 3 o'clock till 8 o'clock, 5 hours. And the fees is rupees 12,000. It is actually 12,000. But the early discount fees is 50%, 6,000. Oh, this I have put the other one. This is the earlier one. It is 27th, like tomorrow, till 26th February. And after that, it is rupees 8,000 on the last day. That is 27th. It is 8,000 rupees. So if you are paying till tomorrow, it is 6,000. Last time when okay. And then plus, if you can call me up or WhatsApp me. I'll give you my number. You can GPay me or any which way. Friends, this is how it is. Okay.
Rajeev, I'll put your details on the group.
Yes, chalega.
So the number and all the details. I think you sent me the poster. शायद you've shared it on TA पे share किया है, मेरे साथ share किया आपने.
नहीं मैंने वो किया है, लेकिन मैं आपको
ये वाला आप मुझे भेज दीजिए. I'll put it up. Okay.
Water shot.
Okay, friends. Any questions? Just put your hand up. I mean, emoji डाल दो तो ना. Jaisal, go ahead.
Yes, ma'am. Sir, I wanted to ask, my cousin a year and a half ago was detected with brain hemorrhage. She underwent surgery and everything. So even till today, she's not able to speak that well. Also, she has very little movements with hand and with her feet. We're still giving her therapy and everything, but it's still not there. Do you think this could help her? She's not.
What is the age?
Oh, she's 26, 27.
We can definitely give a good try.
Okay.
Yeah.
She's unable to speak. That was one of the issues after the surgery and everything. It's the effects have stayed that as much that she's unable to speak also at the moment.
See, I can only tell you one thing. That's why I told you someone was asking about some disease in the earlier anxiety class also. So I say I don't know. Very honestly, I don't know because I don't know the client. Because it is not just the speaking, it's moreover in the connect that happens.
Right. Okay.
Are you getting me?
Right.
Sometimes it's like the physiotherapist I talked about, who was supposed to go for a surgery. And she was just, and with that kind of mentality, mostly people are analyzing her, but she just allowed herself and she's saying, Rajeev, this is so amazing. I can feel each and every cell of my body. And it was just 1.5 hours and it was a complete transformation. Next session, she said, Rajeev, I'm much better. We just did 2 sessions and
Right.
6 years later, she's saying, Rajeev, I didn't have to go for a surgery. The
Right.
same thing happened with the person who was having cancer. He took medicines for 2 years and went to homeopathy, took 2 years homeopathy. The doctor sent her, I don't even know the doctor, he sent it. And he'd seen me sometime back in one of these workshops when I was doing an intro talk. That was 4-5 years ago. And someone who couldn't even walk was driving 50 kilometers a day. And then he did a concert for 4 hours. So anything can happen.
Right. Okay.
Right?
I'll get your number and connect with you personally.
Yeah.
Anyone else? Any other question?
Thank you.
Ranika,
Yeah.
aa jao.
Namaste, sir. Thank you for the very fantastic presentation. It was really very interesting. I have a question regarding how course somatic healing can help autistic children, and specifically for genetic disorders in children like TSC, that's tuberous sclerosis complex. That's a very complicated disorder, and we have high functional children in that.
I don't know, very honestly. I don't know because I don't know how you do it because I have not had many autistic children coming to me.
Okay.
Rather none. Are you getting me? But I definitely work with homeopathy or other medicines with them or Park flower. I've worked with autistic children with homeopathy. So I can say that it works wonderfully well. So I can say that, but I haven't had the opportunity to work with an autistic child over there. But I've had people who have been working with children and otherwise, and they're saying they have been able to find results. I don't know about autistic children, but definitely ADHD and all that. They said they have found good results. So I cannot say that. Yeah.
Okay.
See, one thing, Ranika, it's not about the name of the disease. It doesn't matter how complicated the name sounds and difficult to pronounce. It doesn't matter. If you are able to connect to the person and be with the child, it can work. Are you getting me?
Right.
This
Yes.
is how it is. So that is what I would say, Monica.
Okay. Okay. Thank you.
Nidhi,
Yeah, yeah. Okay.
Nidhi, go ahead.
Just taking this, thank you, Dr. Naidu. It's a really, really amazing session. I mean, I've had just wow moments all through the time that you've been speaking. I wanted to, the point on autism, you also mentioned that it changes the DNA, right? So, I mean, I'm just thinking aloud. Don't you think that genetically something can be altered when you work with autistic people as well?
That's what I said. I don't know because I haven't had the opportunity. And I have not done a research on this, but then the way it works, because when we talk about the live DNA, the live DNA responds to the feelings. And when we are changing those feelings, like this lady starts saying that I feel like a man now, I feel like a woman now. or I have started developing feelings for people. So definitely there's some feeling changing, and that would impact, when we're talking about epigenetics, it is impacting the feeling around the DNA, and that will impact the DNA and the mitochondria, and thus bring about a change. So that is how I would think. And that's all what
How
we
is
talk about the
medical
quantum
science
shift.
reacting to this?
I don't know. See, one of my problems is that I don't step out at all. I don't relate to people. I don't connect to people. I don't talk to people. That's one of the issues. I just work on myself, and I teach this, and I'm quiet again. So I don't connect on the social media also.
So Rajeev, if I have to just answer this question about
Yes, please.
children, and I guess what you just said about the kids. So, what my thought on this is that the child has the DNA from the mother, correct, and the father, right? And at conception, the child received whatever, right? So I would say if you work with the mother, not the child, Ranika, if you work with the mother and take the mother back in time, like with the core somatic, to work with the cellular memory, because she still holds that memory of the child, right? At conception. So if she surrenders to that space, then maybe there could be a change in the child's DNA structure. Because after all, like Rajeev said about the essence, and he also spoke about the light DNA. So the key is that if we are able to connect at that deepest level, like the C0 level, which you all don't know, but Rajeev and we know. So at the C0 level, Rajeev, then maybe through the mother, you could create some change in the child.
Yes, it could be. Yeah.
That's
So
what I would do it like that, rather than working with the child. Yeah.
So one thing that I can say, which I didn't mention because that was too mild a case for all the names that you gave, Ranika. That's why I didn't mention. But there was this child who was suffering from severe loose motion. She was just 2-3 months old, and the mother was very panicky, new mother. So you can just imagine. Yeah, even if it's an old mother, doesn't matter. She will always panic. So she said, "What to do? What to do?" So can I do core somatic? I said, "Try it." So she said, "Rajeev, what do I do?" I said, "Just notice the child, feel the child, and do what's happening in your body." So she kept the hand on the child's tummy, and she started observing what's happening, and she realized that I'm so anxious. And we all know that when you are anxious, your tummy can get worked up, and you can lose motion. And she's saying, I did that, I kept doing it, and next 2 hours, the loose motion stopped.
Correct, absolutely.
That's one. Second, this was very beautiful. Like the way I'm taking the session now, in one of the sessions, I just happened to tell people that, okay, I will teach you how to do it 5 minutes. And I think it was just for her, maybe I did it in that session. So I showed her what to do. I just told her, okay, feel your body sensations. She felt it, and she went back home, and her sister was pregnant. She was to deliver, and she delivered, and for next 4 days, she had not passed motions. And the doctors are doing whatever it's required and everything, but she's not passing, which can happen after a delivery. And she was not passing, and she was feeling so uncomfortable, and nothing is working for her. So this lady goes and tells her sister, see, I have learned something. मेरे को नहीं आता है, 10 मिनट उसने कुछ किया है, मैं तुम्हारे पे ट्राई करता हूँ। बोला क्या करने का? बोलते कुछ नहीं करने का, ऐसा सेंसेशन देखने का, ऐसा देखते रहने का बस। She's saying, I saw it, and I told her, and the sister agreed. And she's saying, we did it for half an hour, and within next 2 hours, she passed motions. She's saying it just happened, and then she joined the class and all that. So it just works like that. So that's why I said it amazes me how it works. Like when I start, I'm very skeptical because I don't know क्या होगा.
हम सबके साथ होता है. You start therapy.
Yeah, so because
when you start therapy, you're wondering, yeah, at the end of the therapy, होगा क्या? इसके साथ.
But at the same time, what Trupti said, even with elder or older children, older me, even with 25, 35-year-olds, when I see that the girl is so stuck up, so struggling, and so stubborn and not moving, I sometimes work with the mother.
Yeah.
I tell the mother, you come in. And I started doing that, working with both, and I seen that the more I work with the mother, the child gets healed faster. And this girl I'm talking about is 35 years old. She was so violent in her expressions for the last 3 years. And the mother is like, she's saying, Rajeev, I can't thank you enough. She's saying, वो शांत हो गई. वे आराम से बैठ, तो हम लोग ड्रेड करते थे कि रूम से बाहर आए, तो हम चाहते थे कि नहीं आए रूम से बाहर, अंदर ही रहे पूरा दिन. लेकिन अभी वापस वो जान आ गई है, वो चलते फिरते ऐसा मजा आ रहा है. You can just imagine how it is.
Surrogacy work जैसे हम करते हैं निधि,
Surrogacy work, yeah.
है ना? You can do it with
But
like this also.
I don't work through the mother. I don't work on the child. I just work on the mother and heal the.
Yeah, correct,
yeah.
correct. So the key is that, but what I'm saying is you can use somebody else to work on
surrogacy
the
work.
client, yeah. Because that's the only way to do with autistic children.
Yes.
It becomes very difficult otherwise to work with them.
Dr.
Veena?
Raj, yeah.
Veena, yeah, go on, ask it.
I come across a lot of people who are interested in therapy, but they have a lot of resistance because of a lot of reasons, kind of thing. Will this work to break the resistance?
100%.
Yeah.
100%. But then there are different ways of working for breaking resistance. See, I also counsel, but I realize my counseling styles are slightly different than the regular counseling. So I'm a bit firm, very. I work with the client. Like yesterday, I told someone, okay, get out of my clinic. Come on, I don't want to work with you. So he was shocked, 21-year-old, and he's like, okay, but then this is that. My father is like this. I said, please get out because I don't want to work with you. He said, what happened? I said, because I don't want to work with you. I can't see anything happening for you. You are not your own self. And then he's saying, and then I gave him a dialogue.
Yes, Ranika.
And I said, तू बॉस तू सोए वाले को जगा सकते हैं, जो जागा हुआ है वो सोने का एक्टिंग कर रहा है, तो क्या उसको करने का? He's saying, नहीं, मैं तैयार हूँ. Tomorrow is coming. He's so excited. He's saying, I'll do anything to change. So excited. I will tell you, I don't need to do any next session. Because वो आदमी को पता चल गया उसने क्या कर दिया.
गाली वाली दे सकता है राजीव क्लाइंट को.
गाली वाली सब देता हूँ. Thank you for that.
कैसे मैं भूल सकती हूँ? तुम गाली दे सकते हो क्लाइंट को.
वो आराम से तो फिर एकदम अच्छा से गया. तो it is like that. But I realized the resistance is in me, not in the child, in the person. I got to keep breaking that resistance. Can you get that?
Yeah.
And then you will see how you can heal people, because there are no resistant clients. There are only resistant therapists.
Exactly.
और ऐसा कुछ भी नहीं है जो हम लोग के थेरेपिस्टों की जिंदगी में नहीं हुआ, जो क्लाइंट की जिंदगी में हो रहा है. हम लोग भी वही माँ बाप का तकलीफ है, वही भाई बहन का तकलीफ है, वही हस्बैंड का प्रॉब्लम है, वही वाइफ का प्रॉब्लम है, वही बच्चों का प्रॉब्लम है, वही हमारे कुत्ते के साथ हम काम करते हैं, और वही दिल दुखा है, 2-4 रिलेशनशिप इधर उधर हो गया है, सबका लाइफ में आड़ा टेढ़ा हुआ है. Are you getting me? Only thing, like some people cry in the Mercedes and some people cry on the cycle.
I think the course Somatic, as Rajeev was speaking, I had this thought in my head, Rajeev, कि if we didn't know what was inside the, let's say, kind of, the kind of helium balloon, we would wonder, helium balloon, how the hell it is flying in the sky, correct? So similarly, we don't know what is inside us.
We don't know.
So we don't know that we are actually a miracle.
Yes.
Unless we remove that, helium balloon में helium gas है, then we will know कि helium balloon उड़ कैसे रहा है. So I think that way we are those helium balloons, Through course Somatic, I think when we release that, we understand कि oh my God, हमारे अंदर ये सब भरा हुआ था.
Yes.
That's why we were the way we were, or we were diseased. So I think, let's just take the gas out, kind of stuff, and understand ourselves better. That's all.
Swati.
Anyone else?
Swati.
Swati. Bol beta.
Yes, ma'am. Sir, I want to know that whenever the narcissistic abuse happens, we cure the family or the victim of the narcissistic abuse. With the core somatic, can we deal directly with the narcissist?
If the person is coming in,
Yeah, person has to come
The
down.
narcissist does not.
Person को
Yeah,
आना
the
तो
person
पड़ेगा
has
ना.
to come, but the narcissist will never agree to come. So only therapy is for the family.
माँ खाना पकाती है, बच्चा बोलेगा मैं खाएंगा ही नहीं.
Like
माँ
for
क्या करेगी?
that,
तुम ही
ma'am,
खा
for
लो
that
मेरे
we
लिए.
don't have. Now for that we don't have the surrogacy like we.
Could be.
अरे बाबा
See, that is
surrogacy
what
कर सकते हो, पर
कर सकते
everything
हैं.
के लिए नहीं कर सकते ना यार.
आप अगर उसका डायरेक्ट, मैं क्या कह रहा हूँ, आप कर कुछ भी सकते हैं, नाम के पीछे मत जाओ.
हाँ.
आप नाम लाइक दैट्स व्हाई रानिका ने इतना सब नाम बताया. अभी तो मेरे को रात को नींद नहीं आई क्योंकि मैंने पहली बार ये सब नाम सुना, मेरे को पता ही नहीं है. एंड दैट्स व्हाई आई डोंट इवन मेंशन तुम नार्सिसिस्टिक बात. ठीक है चलेगा, मेरे को फर्क नहीं पड़ता है क्योंकि सिर्फ क्लाइंट दिखता है सामने. और मैं, आप देखोगे मैं पेशेंट भी नहीं बोलता था कि मेरे को पेशेंट नहीं दिखता है, बीमार नहीं दिखता, मेरे को सिर्फ क्लाइंट दिखता है. वो क्लाइंट मेरे को सर्विस देता है और मेरे को पैसे देता है, और वो क्लाइंट को मैं सर्विस देता हूँ. वो मेरे लिए बीमार नहीं है, वो मेरे लिए ठीक हुआ इंसान बैठा हुआ है. उसको खाली एक रास्ता दिखाना है, उसके अंदर जो एनर्जी से उसको ठीक करना है. बाकी वो बीमार नहीं है, मेरे लिए नहीं है. फिर उसको आप नाम दे दो, एक्सरे निकालो, MRI निकालो, जो भी करो, वो ठीक है, वो डायग्नोस करने के लिए, लेकिन इंसान बीमार नहीं है. समझ रहे हो? और हमें उस इंसान को बाहर लाना है. दैट इज द पीपल आर ओके.
Correct.
व्हाट इज प्रॉब्लम इज द बिहेवियर्स. वो इंसान में कोई प्रॉब्लम नहीं है. और जब भी हम ये जान जाएंगे, और वो इंसान मैं भी हूं, तो मेरे में भी प्रॉब्लम नहीं है, मेरे बिहेवियर में कोई प्रॉब्लम है, और वो बिहेवियर को मुझे ठीक करना है और ठीक करते जाना है. That's why I told that lady yesterday who was suffering from that one of this. I said I'm going to sit back and actually be with myself to heal myself, because why are you suffering? And why is it that you're not ready to take responsibility of your disease? I'm going to heal myself for that, because there was definitely a part of me which didn't want to own up my disease and my life. That was 15 years back. I didn't want to own up. I wanted to blame my brother. I wanted to blame my father. I wanted to blame my mother. I wanted to blame everyone, including my wife also, because मेरा life खराब है. So it shows up in that person. I let it check क्या है. तो कहीं ना कहीं के अंश होगा जिसका अभी तक मैंने responsibility नहीं लिया होगा. And that girl is coming up like that. And I'm going to sit back and work on it day in and day out, and the healing will happen. This is how I work.
I think Swati, what Rajeev is trying to indicate, which you also know, is that when you are going through a certain issue, those kind of clients will start coming to you. You know, if you are going through some emotional problem, you'll attract those kind of clients to you. But what Rajeev is saying is you work reverse. You know, you start working on yourself, that why the hell am I attracting such clients?
Without making yourself wrong.
Correct. And work on yourself, because your some unhealed portion is attracting a client with the same kind of problem maybe. So let the therapist heal himself first.
Yeah.
Secondly,
and then
so true.
Yeah,
the client will heal also. Yeah.
Secondly, Swati ji and all, when we are saying unhealed, like many of these therapists, they take pride in saying that मैं ये क्यों अट्रैक्ट करती हूँ क्यों बोल रहा हूँ, क्योंकि most of the therapists are women. मैं ऐसा क्या है मुझ में जो मैं अट्रैक्ट करती हूँ, and they take so much of pride in that. Come on यार, मतलब ये नार्सिस्टिक हो जाएगा मेरे लिए.
True.
मतलब मैं बोला दूसरे का प्रॉब्लम का भी क्रेडिट तुम ही लोगे क्या? अरे उसको प्रॉब्लम है, उसको लेने दो ना क्रेडिट. तुम उसका भी क्रेडिट लो कि मैंने ऐसा क्या किया है जो अट्रैक्ट कर रही हो. खुद का तो घर नहीं संभला. So first of all, and secondly, when I'm saying that the part, like what Trupti said, the unhealed part, remember she's saying unhealed part in you, not the whole thing is unhealed. Now, उंगली दर्द हो रहा है उसका मतलब नहीं कि मेरा पूरा बदन खराब है, I have to take poison and kill myself. No, मेरे उंगली को ठीक करना है, लेकिन वो क्यों आया मुझे देखना, लेकिन बाकी मेरा पूरा हिस्सा ठीक है. So we have to treat it as an unhealed part. Yes, and rest of me is okay.
Correct.
And when you start doing that, I am okay, but there's a part of me which is not working the way it's supposed to work at the optimal level. That means I just got to do something, remove something, bring in something, add something, or delete something, such that the harmony in the energy flow can happen. And once that harmony happens, you start seeing the shift in the clients happening much faster, and doesn't matter what's the name. This is what I would say.
Yeah, absolutely. I think Rajeev, तूने correct बोला है, because when you do the core somatic therapy, most of you that is okay is helping to heal that part which is not okay.
Yes.
Otherwise, how the hell are you going to get okay? अगर आपके अंदर कुछ okay है ही नहीं, तो आप okay होंगे कैसे?
And that is the kind of people come in. They will struggle, because earlier I would struggle a lot with my clients and come home and I'm tired and I'm feeling so sleepy. And then I wondered, there's something not right with me. And then there were so many parts of me that were disintegrated.
Correct.
There were so many parts in me that were disintegrated. And let me very honestly tell you, transactional analysis helped me a lot. Just to give a name to what's happening. And that is why I'm feeling so good about transactional analysis. That it gave a label to Rajeev, this is what is happening. Oh, injunction, yeah. I said, wow, this is so clear. And the moment it became clear, healing was easy for me. Healing was so easy for me. And after that, it has been a beautiful journey.
So friends, I think...
Niharika wants to ask a question. I think
Niharika, you want to ask a question, beta?
Yes,
Chalo, fatafat, last question.
I have a kiddish question. So like in the webinar, you said that if we are anxious or depressed, we shouldn't take sugar and coffee because it triggers back the old bad memories or reactions. So my question is, when I have a bad day or I'm depressed, or say I've got like if somebody has gone through a breakup, so I would become food indulgent, and especially I would pick up chocolates. And I've heard that it releases
serotonin,
improving hormone called serotonin.
Serotonin.
Yeah. So does it hold any truth?
Yeah. It is all true.
But again, it's caffeine and sugar.
है ना. But वो chocolate तुमको फिर वो chocolate तुमको बार-बार चाहिए ना.
That is true.
या तो फिर तुमको नया बॉयफ्रेंड चाहिए. और दोनों काम नहीं करता.
Otherwise, also if I'm having mood swings, also say.
But the chocolate is required. You become, basically we all got to understand one thing. Whatever is being written on the net, it is for the companies to sell their products. It's not for your health. Nothing is for your health. It's for business. If they want to sell chocolates, they'll write sell it. Chocolate is good. They want to sell chicken, they'll say it's protein or muscle. So they'll say chicken खा के जाओ, and yoga says chicken खाना खाने के 4 घंटे के बाद योगा करते हैं, और लोग बोलते हैं आधा घंटे पहले खाओ. They just want to sell it. Doesn't matter whether you die even.
Right.
Can you get that? So get that what they say is partial truth. In the moment you feel elated, but what about the next thing? Are you healed? Are you getting me? Why do people need sugar? Because it stimulates you. But does it give you that energy where you are like, wow, all the time?
I get it, right. So it's not a solution. It's not.
It is just a solution. It is just a solution for that moment.
Right.
It's a quick fix.
It is not that you get healed.
Yes, Rahul, it's quick fix.
Are you getting me?
Thank you.
Okay, guys, it was fantastic. Rajeev, thank you so much. बहुत मजा आया. First of all, to see you and then listen to you and all that was wonderful. So everybody, I'll be putting Rajeev's workshop on the group. Please do share it with your contacts. And I'm sure you will benefit a lot if you attend his workshop, because first of all, he's fantastic, as you just heard him. And I think the kind of therapy that he's talking about is simple. Simple for you all to comprehend, simple for you all to use. And like he said, it's effective. So why not do something that's simple, usable, and effective? I mean, that's the right kind of work that needs to be done. So I'm sure we all had a good time.
Thank you.
Yes.
And I guess we can show Rajeev, give him a nice stroke. Come on, all of you have done TA.
Really fantastic.
This is
Thank you so much, Rajeev ji. It was a wonderful session. Thank you, Trupti
Thank
ma'am.
you very much. Thank you, Amit. I heard.
I love the style. I love the style in which he speaks. I am impressed.
Thank you.
Yeah. If you do the
I love your
workshop,
smile, sir. I love your smile.
Good, lovely. If you do the workshop, and Swati, if you are the subject, तुझे एक दो गाली तो पड़ने वाली है. तो मुझे लग रहा है कि तुझे workshop करनी चाहिए. तुझे एक दो उसकी kind of जरूरत है, गाली की जरूरत है. इसीलिए.
It was
But
beautiful.
I think that's how Rajeev is. He has his free child up when he does workshops, laughing, joking. And I think that's the way we all learn, really well.
Sir, I'm coming on Saturday. I need that.
Thank you.
Ruchika is coming.
It was so
I need
authentic
that
and such a
gali. I
beautiful
need that.
presentation.
गाली चाहिए, Rajeev. इसको गाली चाहिए, याद रख.
Don't forget me, sir. I'm coming.
Yeah, Dr. Bhuma.
Yes, I wanted to say that it was a very authentic and beautiful presentation. Learned a lot with your presentation, and it was very heartwarming at various points in time where you were talking with your complete transparency and authenticity. Thank you so much. Thank you.
Thank you. So, Bhuma, you're Bhuma, right?
Yes.
I'll just say this to all of you. See, the most beautiful thing about Somatic is, I say this because it connects to your body. It connects to your skin. You are naked. That's why it's authentic.
That's true.
There's nothing beneath that.
And the most touching moment for me was when you mentioned that you see the essence of the client and you are only correcting the behaviors. That is so beautiful, that you are not looking at the patient as a patient, but the essence of the client. And as a dentist, I also kind of feel that they are not coming for a tooth. That's a person with the tooth which is paining, and I need to treat the person.
Beautiful.
So I really resonated with that sentence.
I'm so glad I heard that from you. Thank you.
Dr.
Paulos, a stroke from you.
Rajeev, please excuse me.
Paulos, you need to give Rajeev a
Rajeev.
stroke.
Please excuse me.
Very wonderful presentation. I liked it. I enjoyed it.
Dr. Rajeev, please excuse me.
Karen.
Yes, I'm so sorry. I'm just asking you this at the last moment. I just want to ask you if Somatic would be helpful for somebody who's suffering from cannabis induced psychosis and having a bipolar. I mean, will homeopathy help, because this person is heavily on anti-psychiatric drugs? So what happens with taking psychiatric, one moment is depression, then it's hyper, and then you're getting a post like, so will this Somatic help in this sort of a case?
Yeah, Karen, first of all, I don't know.
Okay.
Second, if the person is willing or no, I don't know, because if the person is so much on cannabis and all that, are they willing to take responsibility of their to the treatment? That is one first thing that I check. If you are sending the person and the person is not willing, I generally don't take the clients. Very simple. Yeah. But at the same time, if the person is willing, I take up any case. So that is how I would say. So it doesn't matter what it is. Yes, if it is psychiatric and the person is heavily drugged and on so many substance abuse and all, we will take more time to heal. I've had this person who was taking drugs almost every day, 23-year-old engineer, 3 or 26-year-old, or 26, 27, 4 years engineering, he's in the 8th year and still not passed his 4th year. And by the end of one, and he would come once a month. We'll just call up, I want to come tomorrow. The mother said, please don't say no to him. Kabhi bhi wo bolega le lena. And young guy never used to speak. just very quiet and just would come and sit in front of me. Okay, tell me. And I will take this. I'm going to mix up all the drugs and I'm going to take. I said, fine, take. And then we talked, and there was one time I just told him one small story as I went about. And that guy didn't say anything, but he had one tear in his eye. And he had come to me for someone who had mentioned that you have anhedonia. That means I cannot feel. And on the first session, I said, I know that you can feel. And that guy was surprised. And then he had a tear in his eye. And the next session, he comes and he's saying, I think I should be leaving drugs. And by the end of 1 year, that is almost 10 or 12 sessions, he comes in and he says, Rajeev, I will leave drugs. I'm not going to take it again. I'm not going to smoke. And this is where it is. And he passed the exams. He's an engineer. That year he passed. So I can just, Carol, I can just give examples like that. Are you getting me?
Yes, yes, doctor. But
then the person is willing, we can work with it.
Yeah, but if the person is, I mean, the person is not willing to take allopathic medicine. So that's what I'm asking. My question is, would you recommend homeopathic in a mental illness? In a mental illness? I mean, because they say that homeopathy is not for these mental illnesses, only for like a physical problem. I just want to ask you.
I'll tell you one thing. Homeopathy is not for mental illness. Allopathic medicines are not for anything. But that doesn't stop them from selling, because it doesn't cure anything. It has never cured, and it will never cure anything.
That is true, Raju.
Because it's a chemical that is working for the moment. But when it works in the moment, it works like magic. So you can't take that away from allopathic. Because when it is crocin is like crazy. It works means it works. When you have a heart disease and you are going to die, that one shot is so important. Yeah. But just putting down some other science doesn't make your science higher and bigger. That is what I can say. So it works. It works wonderfully. Homeopathy works wonderfully for you. You have to get the homeopath, right homeopath. That is what I would say. Okay, Carol?
Okay, thank you, doctor. Yeah. Thank you, doctor.
Okay, Dr. Rajeev?
Okay, Rashmi.
Dr. Rajeev, is it okay if I call you in 10 minutes and speak to you about OCD?
Yeah.
Because my son is suffering from OCD and he's on medications. But after listening to you, I have great faith that medicines छूट जाएगा और ठीक हो जाएगा.
मेरे पास case है OCD का, like severe bad psychologist, university topper. Her medicines have come down from so many to 1, and her OCDs from hours of washing her private parts, it's come down to once I wash it. I can say that.
Right. ठीक है. So my son is also a topper. Problem वहीं आती है क्योंकि ये बहुत सोचते हैं. And he's into Johns Hopkins doing biomolecular and tissue engineering. काफी ये यहाँ पे issue.
Wow.
Speak to him.
I'll talk later.
तो ये आपको 10 मिनट में फोन करेगा and he'll talk to you. Is that okay if we call in 10 minutes?
Yes.
Okay,
doctor. Thank you. Thank you.
Okay, friends, I think we should wind up and call it an evening. So superb. I think we had a fantastic crowd today. Everybody was very interested in the subject. Yeah. Okay. So thank you, Raji, once more.
Thank you.
Thank you, Dr.
Thank you so much. Thank you, Paulos, for coming in. I'm so happy you came
that
in.
Was like a surprise.
Yes, a surprise for us, and it's really nice. And thank you, everybody else.
These days, there are so many online courses. So I was free, I could join.
Wonderful. Next time you have to make yourself free to join.
Okay, no, I'll do that. And I'll do that.
Okay. Chalo. See you all. Bye-bye.
Thank you, ma'am.
Bye.
Bye-bye.
Good night.
Bye.
Thank you, sir. Thank
Thanks,
you, ma'am.
Ruti.
Thank you, everyone. Bye-bye.
Thank you, dear.
Bye-bye. Thanks.